Hello, and welcome to Thoughts on Therapy. I'm Bryan Stevens. I'm a licensed professional counselor with the practice in Marietta, Georgia, and I'm the founder of TalkForward, who's bringing us this podcast today. I've been active in behavioral health for over 25 years, and in that time, I've met all sorts of knowledgeable people. Thoughts on Therapy is a show to bring their knowledge to the general public. And I am very excited today to be talking with Mark Feinsilber, Ph.D. He's a licensed clinical psychologist practicing in Forsyth County with over 35 years of experience treating and evaluating children, adolescents, adults, and families. Mark specializes in, among other areas, the treatment of anxiety disorders, mood disorders, divorce, blended family issues, parental reunification therapy, and ADHD and learning issues. In addition, he routinely performs parental fitness and child custody evaluations, as well as criminal forensic evaluations for the court systems all over the metro Atlanta area and the surrounding counties. He has been awarded the Best of Forsyth designation for the past 3 years running. So welcome, and I'm so excited to be talking to you today.
Thank you, Bryan. It's really good to be here.
Yeah.
Pleasure to be here.
Thank you. So, boy, I tell you what, court custody, forensic evaluations, testifying, these are all things that many of us as therapists actively try to avoid and not get involved in. So I guess kind of starting off, how did you get involved in parental fitness and child custody?
Well, it's a good question, Bryan. And I, like many others, also avoided it for many years, to be honest. But I think over time, and doing a lot of family work and a lot of therapy with children, adolescents, and their families, many of these cases, of course, involved divorce, blended families, custody and visitation issues. And it started out really by just providing input as a therapist to various attorneys or representing clients, or to attorneys serving as guardian ad litems in custody and visitation cases. And then through some experiences in testifying and providing affidavits, I became more active and realized that it was an area that I could provide some needed help in a way other than just direct service therapy, that I could provide maybe insights that would benefit child welfare, and maybe bring some information to bear to a table where many things are legally oriented, and instead look a little bit deeper, take a deeper dive into some of the family situations, parenting practices, and again, with the idea that this would benefit children in a little more indirect way. So that's kind of how it evolved.
Okay. So it sounds like you would really consider litigation as in this area is pretty important when it comes to child and family welfare.
Definitely, Bryan. And I think it's an area where there's sort of a confluence of psychology and the legal profession, in the sense that there are so many psychological issues for attorneys to consider and guardian ad litems to consider. And these are individuals who are very well trained in the law and have a lot of experience with families, but aren't trained as psychologists. And therefore, we have the advantage of being able to go a little bit deeper and maybe ask questions that they don't answer, or they don't ask rather. And then kind of work together as a team. So I look at it as a team where, I'm just part of a team that's trying to make a good decision about, a child or a group of children's welfare.
Okay, that makes sense. A lot of us know what an attorney is. We understand the attorney side of things. And I worked in community mental health, so I know what a guardian ad litem is, and I've actually worked with them with a number of clients, both children and adults. But I wonder if we might talk a little bit about the guardian ad litem and their role and mission, since you brought that up, and so people can understand that.
Sure. A guardian ad litem is an attorney that's assigned by the court to a case. It's a nonpartisan role, so they're not representing either side in the case. Their client essentially is the child or the children. So they're really there to be a safeguard or a stopgap measure to make sure that decisions are being made in the best interest of the children. They're there to look into all kinds of family variables, to look into historical variables, to look into living arrangements and situations. And therefore, they have a lot of latitude to interview a variety of people, including all the parties involved in the case, to review all kinds of data. And then their opinions are then ultimately provided to the court in a report called the guardian ad litem report, which the judge reads and the other attorneys read. So their role is really to be a welfare-oriented attorney function, for lack of a better term.
Okay, so they really become looking after the interest of the children. So we've got like a divorce or custody case. We've got each of the parents, and they've got their attorneys and their representation. And the guardian ad litem, it sounds like, is the court's realization there's somebody else's welfare at stake, and they need an advocate too.
Exactly, and that would be the correct term, is advocate. They're there to be an advocate for the child, to be in an objective, nonpartisan role. And they're not always assigned to every case. Many judges will assign a guardian ad litem in juvenile cases. Sometimes there isn't one assigned at the outset, and one or the other parties involved can, through their attorneys, request that maybe one be appointed.
Mm-hmm.
And in that case, oftentimes the court will appoint a guardian ad litem, identify one, and appoint that guardian.
Right. So how, we're talking about roles and missions. And so you was kind of coming in as this psychologist. How would you describe kind of your role or your mission in regards to helping the court make good decisions in the child custody matters?
Yeah, I guess in a lot of ways, I see myself in these roles as kind of a psychological guardian ad litem. In other words, my main purpose and function is really not that different, except I'm coming from within the field of psychology and clinical practice, whereas the guardian ad litem is coming from the field of law. But again, I regard myself as a member of the team that kind of makes decisions. So again, I'm hoping that whatever input I can provide through my own interviews, psychological testing, review of relevant case data will add something to the equation that eventually brings a good decision for the case and a good decision for the welfare of the children.
Right. Okay. I like that. That makes sense.
Sure.
I have not done a lot of child and adolescent work in my life, but I have helped guardian ad litems with adults, people with schizophrenia, and maybe there was a guardianship hearing or those things. Be able to get up there and say, well, I'm here for the client. I'm here to help have the best outcome for the client.
Right.
And be able to make those recommendations. What sort of things do you do, in terms of collecting data, evaluations you might use to make those recommendations?
Yeah, I guess it's interesting how not everybody does these the same way. And I guess my approach sort of evolved over time to where I'll start out kind of at a light level and then dial in more involvement as I go along. So the first thing I typically do is I will interview the parents, the children, just kind of get an overview of the situation, get their initial impressions about what the case has been like, what it's felt like, just get some history data. Then I usually will proceed to doing some of the psychological testing, and that can be sometimes just with the adults where we're just looking at that. But in most cases, when it's an actual custody evaluation, I will be testing the children, at least to some degree, getting some kind of objective data about their current mental health status, their functioning levels, things like that. Now, of course, in a parental fitness exam where it's kind of just a partial version of a custody exam, there may just be one parent being looked at in terms of their suitability to continue as a custodial parent. Right. And I'm not being asked to make a comparative or a relative judgment about the two parties as placement. I'm just being asked to look at one party that may be alleged to have some issues, and we're trying to ferret what those issues are out. Okay. But in most cases, I'll follow a procedure where I'll do some initial interviewing, psychological testing. I'll get data from collateral persons that know the parties involved, like either other caregivers, friends who have been able to observe them as parents around their children, any other caregivers, as I mentioned, some usually family members. And then, of course, I will talk to or I'll get records from the attorneys if there's been any kind of criminal actions that have been gone on, or let's say there's been supervision of visitations already going on from a previous court ruling, I'll usually try to get data from the supervisors of those visitation appointments,
Right.
things of that nature.
Okay.
Yeah.
Okay. Yeah, that makes sense. Well, that's so interesting thing. You talk about kind of getting the collateral information or from other people. That's one of those things as a therapist you can struggle with. Boy, I sure would like to talk to that person. Or like to hear from this person. I guess now that you have the courts involved, a little bit easier to hear from some of the other folks because
Exactly.
Right.
Exactly.
It's like, well, you need to talk to me or you might not get the outcome you want. It's like, okay, we'll talk to you.
Yeah.
Well, now, with that being said, courts and confidentiality always, I think, and this is where I think a lot of therapists are uncomfortable with any sort of forensic work. And of course, when, forensic work and court evaluations, there's legal records and things are entered in the legal records.
Right.
You can have, well, mom's hired, and we've had this, well, mom's hired therapist, but dad's also interested in, he also has custody of the child, who has ownership of the record. So how does this information you gather and you share with the court, get secured, and who gets to see it, kind of besides you, right? Because we're having to share it. That's what the role is.
Yeah.
How does that intersection of court and confidentiality come into play?
Yeah, that's a good question, Brian. And that is a very common concern where, you're kind of in an arena outside of therapy where those boundaries are much more clear. Like, for example, in doing therapy, and I'm sure you're aware of this too, that we cannot reveal anything regarding minor children, for example, without their parents' written permission.
Right.
For minors, and sharing any kind of information or records and things like that. Now, in the case of the court scenario, it's a little bit different because the court can mandate the sharing of records, at least, for example, to the guardian ad litem in a case. So typically, like if I'm doing a child custody evaluation, I will write up my report, and then that gets shared only with the guardian ad litem to start with. The guardian ad litem has then the prerogative, and in most cases will share it with the respective attorneys, all of that being sanctioned by the court. But I cannot share that report with anyone else.
Right. Okay.
So even if the parent asks me, I'd like to see a copy of the report, I cannot do that. Now, it doesn't mean I can prevent their respective attorneys from at some point sharing it or talking about it with them.
Right.
But the flow of information, from my standpoint or from my point of view, really tends to go just to the guardian ad litem and the guardian ad litem to the court. Right. So those are really the only two people in the loop at that point, unless the guardian chooses then to share it with the attorneys.
Right. Okay.
Yeah.
All right. That makes a lot of sense. Actually, it makes me feel a little bit better as a therapist.
Right.
But, again, working in community mental health, we had a lot of people who were court ordered, and it's like, well, your records are going to the court.
Yes.
Or, when we had people working with the mental health court or the drug courts, well, the judge gets to know how you're doing in treatment, because that's part of the deal.
Yeah, exactly. And just to add to that, we can also, in terms of the latitude we're given in custody evaluations, which is usually spelled out in the court order for the evaluation to happen, we can also, like, for example, if there are suspected issues with drug or alcohol problems, we can even require the subjects of the evaluation to get random drug screens or alcohol screens and things like that, which we can do. And of course, we're privy to those records. And then, of course, but again, those records would only go to the guardian ad litem and to the court, in other words, the results of those findings. But we're given a lot of latitude in terms of what kind of data we can gather, actually.
Right. Well, and of course, even with with the way the laws are written, teens start to have rights of confidentiality around substance abuse, even before they reach their age of majority. So
that's right.
Yeah.
Exactly.
So that starts to be, well, we're in this process and we got to talk to the guardian.
Yeah.
Well, kind of speaking of their teens burgeoning agency, that the law starts to say, no, it's not like everything before 18 is one thing and after 18 is another. What sort of voice do children and teens in a divorce process get to say? I always, you have this image of parents fighting, over the children, and it's like, when do how are their voices heard?
Another good question, Brian. And that's been, I guess, a complaint or a frustration sometimes with some of the children I've interviewed and worked with, where a lot of times they don't feel that they have a meaningful voice in the proceedings. I will routinely always listen to what their feedback is, what their preferences are, what their concerns are as far as where they want to be and where they don't want to be, and what they like or dislike about the respective parenting environments. Now, how much the court puts weight on that can vary. Now, there has been a practice, it's still going on, but it seems to be less frequent, is where one parent might have a child or a teen write and sign a letter of preference. I would prefer to live with my dad because of X, Y, and Z, or I would prefer to live with my mom. But the problem is, historically, those kinds of letters have not been given a lot of validity, and probably rightfully so, because many times they're manipulated or coerced out of the child.
Right.
The child feels an issue of divided loyalties and feels a pressing need to do this, but maybe doesn't have the judgment or the overall vantage point to really know what's best for them anyway,
right?
Because they're just not mature enough to fully take into all the variables. So that's become kind of a less frequent practice, but that was one way that children were getting a voice, if you will. Now it seems like it's more meaningful to get their voice through interviews with the guardian ad litem, through interviews with the evaluating psychologist. Those kinds of opinions are expressed in the report. And if there's enough consistency in what the children are reporting, then the court, of course, has to take that into account, even though, the court ultimately makes the decision, but at least their voice is being peppered through the whole process, through the guardian ad litem and through somebody like myself, if that makes sense.
Right. Even though it's hard for the child or the teen to see that happening.
Yes.
Yeah. Well, I mean, again, I know as a therapist, there's a lot of times as adults, we don't actually know what we want or what our preferences are. We feel pressured by outside forces in order. Well, I'm trying to make the harmonious decision. And obviously, as they get older and their brain's formation improves, there can be some, okay, this is what I want, or I've got a better idea of what I'm doing.
Yes.
Yeah. But So I mean, I've seen a number of, I've got clients. It's like, I was with my mom until I turned 15, and then I went to live with dad.
Yeah,
especially young men. It's like, now I want to go live with dad.
Yeah, exactly. And I think developmentally, and in terms of their identification with the same gender parents, so whether that's part of their growth, is sometimes boys, as you pointed out, feel a need to be with their dad. And if there's a good cooperative co-parenting relationship, then a lot of times mothers may say, that's fine, go ahead and be at your dad's most of the time, and we'll reverse the visitation frequencies. For example, if let's say dad had standard and customary visitation every other weekend and more time in the summer and so forth, maybe now that'll flip over and the mother will occupy that role.
Right. And that's ideal. And one of the things about divorce, I think, is not well understood in our culture, and yet is true, is that two people can still love and care about each other, but not stay married.
Correct.
Successfully.
Yes.
And that's where they're at. Those people can often have an amicable divorce. There's still fallout. There's still kind of small t trauma for the kids.
Yes.
It's still something to be worked through, but then we can have some sort of co-parenting relationship.
Yes.
So, and I've seen that with clients. I've also seen, though, these kind of high conflict divorce cases, and you talked about parents influencing children's feelings, and I had clients come to me and they're like, oh, well, their mother is just poisoning them against me.
Oh, yes.
Yeah. So what have you seen about ways that parents may do that in these high conflict divorces?
Yeah, it's what I've run into, unfortunately, more of the time than not. I mean, your utopian example earlier of like two parents that amicably part and then keep the interests of the children at heart and then remain good co-parents, don't talk negatively about each other, and just promote the children's best interests. That seems to be more the exception than the rule, unfortunately.
Well, I would believe that. Married parents have difficulty not talking negatively about each other.
Exactly.
Children.
Exactly. Yeah, exactly. And of course, that practice may have preceded the divorce itself, where the children were privy to hearing that even during the marriage when everybody was together. But I think to answer your question, there's many ways that children can be negatively influenced. Of course, we lump it under the broader heading of parental alienation. And that's a broad spectrum of behaviors that can be very mild and subtle and all the way to things that are very overt and direct. But the general idea is for one parent, the goal of parental alienating behaviors is to undermine the relationship of the child or children with the other parent, to somehow make the other parent sound negative enough or blameworthy enough that the attachment gets disrupted, or the goal is to try to disrupt the attachment. We see it a lot in situations where, for example, maybe there's a new partner in the picture. Maybe let's say it's a father who's now got a girlfriend, a serious girlfriend, or even has remarried. And maybe there's unresolved issues with the mother about the divorce, and therefore she tries to vilify or malign the father because he now has a new life, a new marriage, and maybe she does not.
Right.
Or sometimes it's about money issues. It can be a lot of things, but it's always damaging to the children. That's the concern, is that it's always damaging because they usually love both parents and they're put in a position of, what do I believe? Sometimes the children are so confused, they don't know what to believe to be the truth.
Right. Well, and many times children's kind of core belief that why mom and dad got divorced is I screwed it up somehow.
Yes, exactly. And not all parents do a good job of absolving the children from that fantasy responsibility, because it's usually not the children's fault, of course. But some parents are not as dutiful as they need to be about making sure they clear the children from that concern. So some children go into the divorce arena thinking that maybe I had something to do with it because my behavior wasn't the best, or I wasn't doing well in school, and it caused my parents to argue, and that's what led to our family breaking up. Terrible burden for them to bear emotionally, of course.
Yeah, I agree. And unfortunately, children are one of the great stressors on marriages that, I talk to my clients, the things you must be able to have open and honest conversations about are money, children, and sex.
Yeah. Always the big three.
Those are the big three. And if you're not having open and honest conversations about those three things, there's problems. It's because those are the stressors on the marriage. And I worry about, for kids, it's like, what do you want? Well, what I really like is us to still be a family.
Mm-hmm.
And and so I think then what we see, right, is children in these teens, start acting out their kind of these own emotional conflicts. So what are kind of some common things that you see as they go through these?
Well, the children can display their stress or their unwellness in a lot of different ways. It can either be overt acting out behaviors. Sometimes children start getting involved in the parental alienation game themselves, so to speak, in terms of reporting or becoming, cohorts with the parent. And sometimes parents actually will try to cohort their children into, for example, finding out information about what's going on at dad's house or what's going on at mom's house, or how serious is the relationship they have with their girlfriend or boyfriend, or how are they spending the money that I give you for child support, that I provide for child support. So they can get enlisted as cohorts, or I call it being deputized, in a way to get into a very unhealthy kind of cohort relationship with that parent who's trying to undermine situations. Wow. Right. And children, depending on the resiliency, the emotional strength of the child, some children bear well enough under it that they just continue these behaviors, and others start getting symptomatic. They might get anxious, they might get depressed, they might start doing more poorly in school. Some of them run away. So it's a wide range of things we can see from the children. Most children have a threshold where if this goes on for a long enough period of time, they're going to hit some kind of emotional wall.
Right. I can definitely see that.
Yeah.
It takes that kind of enlisting children into parental alienation, takes parentification of children that we see.
Yes.
To a whole new level.
Mm-hmm.
And that's really kind of scary, because I know I've seen many older children of divorce that I've seen in my practice will come in, and we talk about what's your childhood like growing up, and some of them are like, no, when my parents broke up, it was great because things calmed down.
Yeah. Mm-hmm.
And then they stepped into, and then I was helping mom take care of the 3 younger siblings.
Yeah, that's right.
It's like, well, what? So your childhood was either chaos, or then you had to, suck it up, buttercup, and be an adult.
Exactly.
Because you're the oldest at 13. And it's like, well, and now you're in my office because you kind of feel like you need to be a people pleaser. And right. Is that how you want to live? And so, yeah, even if parents get divorced amicably and they do none of this other stuff, which you said utopian, children are still going to walk away with that concern and what does it look like, and what does a good relationship look like. I know adults whose parents got divorced when they were adults. And that causes them to then bring their own relationships into the equation, because this structure, this fixture of their past, fell apart.
Exactly. I agree. And I see it in some of my adult clients as well, where you would think that would be long in the rearview mirror in terms of the effects on their lives, but it's still there. It's still potentially disruptive for them, emotionally. And, to your point earlier, Brian, I want to bring back that idea about the cohorting, is that sometimes, even in amicable divorces, as you pointed out, sometimes children kind of self-appoint. In other words, they feel a need to take care of one of the parents, maybe the parents that they're living with, and start taking on, too much adult responsibility, either for their younger siblings or for their parent or both. And they're not even necessarily cohorted into it, but they themselves feel this need because of the kind of relationship they might have had with that parent beforehand.
Right. Yeah. It's definitely an interesting dynamic. And then it's like, well, and then we get to adulthood. What do we do without that? So I love the idea that we can address it more when they're younger.
Yes.
Not that it won't crop back up later. Every time I think I've done some work for myself and I've gotten it all nailed down, and then, a few years go by and, oh, that's cropped up again. Well, I guess I'm ready to work on it some more.
Yeah. It's a work in progress. It's not always in one therapeutic, set of visits. Sometimes it will be intermittent over time, where it gets revisited from time to time to finish it out. You're right. Absolutely.
So obviously parents, some parents, kind of based upon their capacity, can kind of get together during the divorce process or after the divorce and figure out a way to work cooperatively. And be able to try to, how do we do the best with what we have moving forward? What are there are some ways that you can help kind of push the system in that direction, or help, probably push for therapists, help maybe lead them in that direction? Try to push in therapy, it's like pushing a rope. So how are some ways that you can do that?
Well, that's part of what comes out of the recommendations section, where you're offering opinions in the end about what's in the best interest of the children. You're also covering what maybe is in the best interest of the adults who are in charge of the children. So those are the areas, or the areas of the report where I may make recommendations about counseling for the adults to maybe resolve issues that are still left over, residual from the marriage, or recommendations for co-parenting counseling for parents that there's a core of something there where I feel like they could work together. There's just some stuff in the way that they need to clear out of the way. And therefore, maybe they should see a therapist who does co-parenting counseling, which I also do in my clinical roles. You know, I do co-parenting counseling, but I often, when I'm the evaluator, of course, I have to refer that out to another party, so there's a conflict of interest. But that can be a useful process, although I think there are some parents where the level of conflict is so high and the level of damage to their relationship is so high that maybe they need to be in a parallel parenting role where they really aren't co-parents, except in a very loose sense. They communicate through our family wizard or neutral means, and they kind of keep at some distance, just try to be cordial. And then you have, you know, the majority of people, I think there is some potential to actually be co-parents, to share information, to talk about their children's lives and their needs, even if they're remarried or repartnered. You know, so that's what we try to do, is encourage that process to happen where we think it's possible for the parents.
And my guess is, in any given situation, couple, rarely are both people at the same level of acceptance or capacity for that. You often can have one parent, it's like, well, unfortunately for this to work, you have to, you can't meet them halfway. You've got to put more energy into it.
Yes.
Work. And often they're the ones like, well, let's put more energy into the marriage. Well, sorry, that's what it's unfortunately what we got to do for the kids. It's that's a real, that can be a real challenge when one parent's really doing everything they can to try to make the co-parenting relationship work, and the other parent is still disengaged and frankly displaying a lot of the behaviors that led to the destruction of the marriage, the dissolution of the marriage in the first place. So
exactly, and those patterns tend to carry over, and that is probably the most frequent pairing that we see, is the one you just outlined, which is where one parent is maybe open to it, more than willing to sit in front of a therapist, take ownership of what they're contributing, and you know, better their behavior around the other parent. The other parent, where there's a resistance or hanging on to that agenda that we talked about earlier, these more toxic agendas. So that is the challenge. And sometimes, you know, as an evaluator, I will recommend that maybe the court either issue a strong recommendation that that parent that's resistant get some of their own therapy so they can bring themselves to the point of being more objective and open. I've got 2 cases like that right now I'm working on, where that's exactly the scenario, where there's one parent that's saying, I'm okay with co-parenting, I'm okay with working together and having a professional guide us through that process. And the other party is just really doesn't want to hear it. So then it's a matter of, does their attorney have enough leverage over them to say, gee, this is really something you should consider? Are the grandparents involved in saying, you know, you really ought to work with that dad because the kids love them and it's hurting them? You know, it's what other outside influences besides somebody like myself or even their therapist are weighing in and saying, you know, this is something you really should be doing for the benefit of the children. But you're right, it's a challenge to bring those people to the table.
I imagine the family practice attorneys almost have to be probably feel like they're junior counselors a lot of the time, trying to coach their clients. And this is really in your best behavior. It was always fascinating to me in the drug court and in the mental health court, how much the DA, the assistant DA that was assigned, really was on the side of the clients. And was really in lockstep with the public defender, and everybody, you have a whole team of people that's like, really, let's help you figure out what's in your best interest. Because what none of us here want, and you're part of this team, what none of us here want is you to be in jail. So it's like, how can we work with you? And so I would guess the attorneys might lean on you sometimes pretty hard. How do I talk to my client? What's the game plan? How do we work together?
Yeah, they do. They do seek that kind of counsel sometimes from me. But to be honest, since as you pointed out, since if they do this work for a while, the ones that have been doing it for say over 10 years, 10, 15, 20 years, they become quasi-therapeutic themselves in the way that they talk to their clients. They become savvy about certain emotional issues and behaviors. And oftentimes, particularly the ones that do a lot of guardian ad litem work, really can have a very good therapeutic influence on the situation, more so than you would expect if you just looked at them as being attorneys. They really kind of have to straddle those two domains in their work. And a lot of them do it very, very well. There's a wide range of guardian ad litem involvement that I've seen working these cases, everywhere from very superficial involvement to very intense, proactive kind of involvement. I have a case recently where that's the case, and even to the point where one of the parents was resenting all that proactivity because that's the parent that still has an agenda, and they were realizing that this guardian ad litem was going to be pushing hard and seeing through some of what's going on because they were involved enough to see that. So yeah, they can be quasi-therapeutic in a very good way sometimes. Yeah.
So yeah, kind of touching on that, because we talked a little bit about the parental the alienation. And I've read more about that, and the court's more aware of it. If that kind of crops up, what can be done about it? Was there anything the courts can do about it?
Well, the courts can, caution or scold clients, or more or less, it depends on how severe the alienation is. In other words, in many cases, the way it's resolved by the court, or the way it's addressed by the court, is to recommend the co-parenting counseling, the co-parenting therapy, sometimes alongside that, the individual therapy. If, for example, some children have been put in such a precarious emotional position and damage is really being done, that it could change custodial and visitation recommendations from the court as well.
Right.
So if a court perceives that it's toxic enough, this alienation, then they can start addressing very different visitation and custodial models as a consequence for this. And in some cases, they have done that.
Okay.
If it gets that extreme.
Right.
Yeah.
So what have you seen, like kind of, you look at children, you look at adolescents, what are some of the things you see that come up between kind of a more high conflict divorce? What I think the people like the term toxic these days, toxic.
Yeah, sure.
Versus maybe a divorce where people are working a little bit more, mindfully about what the fallout of the divorce is going to be.
Yeah. Good question. And sometimes I see very vast differences. I mean, in the low conflict, more mindful divorces and separations, you'll see children's lives much more intact as they were prior to the family splitting up. In other words, their activities, the way they're doing in school, their general emotional welfare. Some kids will even say to me, my parents seem happier apart. I'm glad that they're moving on because they weren't happy together. And that's a big function of how it was presented to the children by the parents. All right. So these children are realizing, yes, it's sad that we're splitting up as a family, but at the same time, it was probably the right decision. And my parents seem happier, and they still love me, and I feel secure with my relationships with them, and they're okay, and they're going to be fine. Then you see the other side of that spectrum where, let's say, a child has been cohorted or taken it upon themselves to be a cohort or a deputy and advance the case of the agenda of the toxic parent and the one that's doing the alienating. Those are the kids that I see being very unhappy. Usually there's a lot of anxiety going on because of that internal conflict about what they're doing, because there are still residual feelings towards the parent that's being alienated. So no matter how much rancor there is on the part of the alienating parent towards that other parent, they don't necessarily share that, but in serving the role, they have to villainize this parent to keep the role consistent.
Right.
So it's a case of like cognitive dissonance. I've got to play the role and even deny my feelings that I still have for my dad, for example, because I've been brought into this situation and think my mother is right, or I think my dad was the bad guy in the marriage and my dad mistreated my mother. So therefore, I should also dislike him and reject him. It's a terrible conflict. So we see the whole gamut from kids where, come out of it pretty unscathed or pretty, intact, to kids that are, getting highly symptomatic and conflicted because of this role that they're playing.
And if the parents kind of post-divorce continue this, we dislike each other, we don't want to communicate well, even if nobody's being, kind of cohorted into a role.
Yes.
It just causes me as a child extra stress. I wasn't happy when you were fighting in front of me. I don't need you to,
Yes.
fight over me.
Right. Exactly. Exactly. And, one useful technique that therapists do, and then sometimes I'll even do in the course of interviewing kids, is getting them to hark back to times when the family was together and what their relationship was like with that alienated parent then.
Right.
In other words, look back for what was the core of the relationship before all this garbage started happening between your parents, all this negative stuff. What about then? I remember one case where a child was walked through this by the therapist that I had recommended them to see, and she was walking this boy back through memory lane with his dad and what their life was like. And and I got a lot of useful information out of that process, because apparently he and this father were very close for years. The father was heavily involved in his sports, coached his teams. They did all these things together. And then when things collapsed between the parents, it's almost like all that went out the window for this boy. And in bringing him back to it, it was therapeutic for him to realize Dad's not perfect. Dad maybe did some bad things with my mom in the marriage that he shouldn't have done, but he and I used to be good. He and I used to be very close.
Right. That relationship is independent of the relationship with mom. Because I've talked about that with couples. It's like, well, we're getting divorced. It's like, well, the person you're leaving is not all bad.
Right.
I mean, outside of, obviously we can have cases where there's significant abuse or et cetera, but the reality is you did love that person. You got married to them at some point. There were good times.
Yes.
And there's this weird retroactive masking where we wipe out. I've decided I'm leaving. They're going to wipe out all the good times retroactively. And I'm going to bring the kids. Oh, well, you'd never had any good times with your father. Your mother was always bad. No, I don't. Kids certainly don't see it that way. Because children, we forget being children, but children look to have connections with their parents because we're helpless creatures in a land of giants that take care of us.
Yeah, exactly. And it's interesting how many children, if not most children, can be brought back to access the feelings they used to have for years for that parent. Many times they want to be brought back, but their consciousness resists it because they're caught up in the role that we've been talking, they're caught up in the alienation game. But really emotionally, deep down inside, they feel most secure when they can re-access those feelings and feel it for both parents.
Right.
That tends to be the way they're most secure. But of course, that takes, counseling, therapy. It takes getting through that resistance that's there to break through the role. And when they do, they seem to be all the better for it.
Right. So the best thing parents can do for their children is work to transcend their own bitterness and hurt. You've got that, and it's yours, and it's real, and you own it. You get to own it.
Yeah.
And what do you do for your children? Because this is their parent too.
Yeah.
And how can I, be there for them? And I may despise my former spouse. And my children still love them because it's their, it's their mother, it's their father.
Yeah, it's like you pointed out earlier, Bryan, it's seeing that as a standalone relationship that has to be respected for what it is. That's a respect you can give your children, is you're free to have the feelings that you have for that other party. Right. Even though right now you may be mandated to see them because you're a juvenile, but later on you're going to be an adult and you'll have full freedom to see them, not see them, care for them, not care for them. But why should I complicate that in your growing up years? Why should I make that a difficult process for you instead of letting you have the feelings that you rightfully had at some point?
Right.
It's a respect issue, I think, at its core.
Right. Well, I don't know how much we respect children. I'll remember to respect children. I'm a big, I didn't know it was really Adlerian as I did it growing up, or with my kids growing up, and I got this, was how much responsibility can my kids handle? and try to give them as much responsibility as they can handle, so they can make their own decisions and be their own people.
Right.
Of course, I've got a 19 and a 17-year-old now, and it's more trying now than it was when
Right, of course.
they were 7 and 9, but yeah, here we are.
Yeah.
So,
Yeah.
okay. Well, today this has just been really fascinating. I've enjoyed it.
Me as well.
I've learned a lot. Maybe it makes being part of the court system sounds so scary to me as a therapist, and
Mhm.
some good feedback. So I will make sure that your contact information is in the comments below.
Okay, thank you for
Okay.
that.
And for our audience, of course, I ask you to please like, share, and subscribe if you want to see more of Thoughts on Therapy. Working to get these out at least monthly. And I've had a good response. So I've actually got a queue of people lined up. So we should be rolling.
Very good, Bryan. And thank you very much for having me. I certainly enjoyed the dialogue with you this morning.
Awesome. I've enjoyed it very much. Thank you so much.
Yes, sir. You have a good day. Thank you.
Thank you.
Bye-bye.